Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us. In this segment, we're going to be having a conversation with Dr. Pichamol Jirapinyo. She's joining us here as Associate Director of Bariatric Endoscopy at Brigham and Women's Hospital. She's going to discuss her study on endoscopic gastric plication and how it's able to reduce portosystemic pressure gradients in patients with nonalcoholic steatohepatitis and advanced fibrosis. It was presented at DDW 2022. Thank you so much for joining us, Doctor.
Thank you so much, Neil, for having me.
Well, give us a brief look into your professional background and talk briefly about your role as Associate Director of Bariatric Endoscopy at Brigham and Women's.
Thank you. So, at the Brigham and Women's Hospital, we routinely see patients with obesity who need to lose weight, and we have several therapies, several procedures that we can perform endoscopically, which basically mean we perform the procedure through the mouth. It's not surgery, to help these patients lose significant amount of weight. And additionally, we also prescribe weight loss medications. Currently in the U.S., we have several medications that are approved for weight loss. So we routinely perform procedures and/or prescribe medications to augment the amount of weight loss.
In the opening, I mentioned that you presented some information at the 2022 Digestive Disease Week conference concerning endoscopic gastric plication. What is endoscopic gastric plication exactly?
Yeah, basically it's a type of an endoscopic procedure to help patients lose weight. And the technique is that we pass the endoscope and the endoscopic plication device, which basically is a stapling device. And then we go into the patient's stomach, and then we place several staples, several plications inside the stomach to reduce the size and the volume of the stomach. And this is a procedure that is performed in select centers in the U.S. And a lot of centers in Europe. And usually patients can lose about 15 to 20% of their baseline weight with this procedure.
Is that weight that remains lost, or do they have a tendency to gain it back often with this type of procedure?
Yeah, so far the data show that the amount of weight loss can be maintained up to at least 5 years. Long-term data is still being studied.
Who would you say is the best candidate for this type of treatment?
So usually we routinely offer and perform this procedure in patients who have obesity, which is defined as patients with a BMI, which is a ratio of the weight and height greater than 30.
Well, take us through your study, if you would. What was the study design, and what were you looking to find out? And did you find out anything that was surprising?
Yeah, so basically, this procedure has been shown to be effective for weight loss. However, the main goal of this study is actually to show that in addition to weight loss, the procedure can also be beneficial for patients with fatty liver, specifically in those who had advanced stage of the fatty liver. So, before we go on, we just have to talk about portosystemic pressure gradient, which is the main outcome of this study. And I'm going to refer to it as PPG.
Great.
So basically PPG is the main outcome that we're looking at for this study. And it is kind of like a surrogate of how much fibrosis or scarring the patient's liver has. So you can think of it as if the patients have a lot of scarring inside the liver, then PPG is high. And for a normal, healthy liver, PPG is normal. So kind of similar to blood pressure. And technically, PPG represents the difference of the portal venous pressure and hepatic venous pressure. And when you think of the liver, basically the blood flow of the liver goes from, you have a portal, the portal vein that brings blood from the stomach, from the intestine, bring the blood through the portal vein into the liver. The liver then metabolizes the nutrients, removes the toxin, and then sends the detoxified blood out from the liver through the hepatic vein back into the rest of the body. So then, basically to summarize, so blood goes from the portal vein into the liver and then goes out from the liver through the hepatic vein. So when the liver has a lot of scarring, then the resistance inside the liver increases. Therefore, blood that is flowing into the liver through the portal vein is having a hard time getting into the liver. Therefore, the pressure inside the portal vein increases, and therefore the difference between the pressure inside the portal vein subtracted by the pressure inside the hepatic vein increases, leading to an increase in PPG. Why is PPG so important? And prior studies have shown that for patients with cirrhosis, which is an advanced stage of fatty liver, an increase in PPG or portosystemic pressure gradient is correlated with worse outcomes, including mortalities. These patients are more likely to develop varices, ascites, encephalopathy, all the complications of cirrhosis. And therefore, when you treat patients who already have an advanced stage of liver disease, you want to decrease that PPG or portosystemic pressure gradient. And that is kind of like the main concept of our study. Mm-hmm. Like, can a procedure that we routinely perform, an endoscopic sleeve procedure or endoscopic gastric plication procedure, can this procedure reduce PPG in patients with fatty liver who already have advanced to an advanced stage, including cirrhosis?
Could you summarize the most important takeaways from the study?
So essentially, we included 20 patients who had fatty liver with advanced stage. And we showed that at 6 months after an endoscopic gastric plication procedure, their PPG significantly decreased. Additionally, the proportion of patients who had abnormally high PPG significantly decreased as well, and they lost a lot of weight.
Asked earlier, or was about to ask about treatment options. Is this something that is readily preventable? And are there treatment solutions that you're, excited about right now?
So traditionally, patients with fatty liver, the treatment that is only available and being routinely offered is diet and exercise. Like, we always tell patients, like, hey, you need to lose weight. You have to eat more healthily. You have to exercise more. And when you have weight loss, that will lead to an improvement in fatty liver and then a decrease in PPG. However, the problem is that some patients, when you do diet and exercise, the amount of weight loss might be about 5% of their baseline weight. And additionally, some patients may not be able to achieve enough weight loss to have that significant reduction in PPG.
So then they become a good candidate for the procedure, right?
Exactly. And that's why we're kind of like seeking other treatment options outside of diet and exercise to see if the weight loss treatment options can be beneficial for patients who are not able to have a reduction in PPG with diet and exercise.
Doctor, give us a website where we can learn more.
So if you go on www.brighamandwomen's.org, we have a link on endoscopic treatment options for weight loss that we are currently performing for patients who need to lose weight and or patients who have fatty liver.
Doctor, I appreciate you sharing some of your time with us this evening. I'm hoping that we'll speak again.
Thank you so very much, Neil. It's my pleasure.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Pichamol Jirapinyo. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.